Catholic Health Services, 6 hospitals on Long Island offer a wide range of services for women. And now at Mercy Medical Center, there's a team of specialists offering comprehensive gynecologic care. And joining us via Skype is Dr. Peter Sticco, who is part of that group. And Dr. Sticco, welcome.
Good morning, Colleen. Thanks for having me.
You are a minimally invasive gynecologic surgeon. Please
Correct.
tell us all about that.
Absolutely. Catholic Health Services has really been keen on employing highly specialized physicians within the women's health department as a whole. And as a fellowship-trained minimally invasive gynecologic surgeon, I completed additional years of surgical training after my OBGYN residency. And this allows me to utilize the latest surgical techniques, which use advanced laparoscopy and robotic surgical approaches to treat a wide array of gynecologic disorders. And these can include things from women suffering from endometriosis with pelvic pain and infertility, uterine fibroids, ovarian cysts, abnormal bleeding, and that's in both the pre- and postmenopausal patient populations.
And the benefits of this surgery are?
So benefits include less blood loss, less scar tissue development after surgery, shorter hospital stays. Most patients actually go home the same day as surgery for operations in just the recent past that would have been done with an open, large incision with a hospital admission that could last 3 to 5 days. And so this really allows for an overall quicker and easier recovery, which gives patients the opportunity to return right back to their usual daily activities with an improved quality of life.
It's so great. The advancements are just so amazing. Tell us about the new location at Mercy.
Yeah. So we've recently opened a new office in the Ryan building within the Mercy Medical Center campus. That's Suite 204. And we'll actually be opening an additional office at 2200 Northern Boulevard as well. Our current office contains the Center for Minimally Invasive Gynecologic Surgery. And in addition to that, there is also the GYN Center of Rockville Centre, which focuses on women's health and fertility. And we also have the Center for Pelvic Health, focusing on urogynecology. Also within the Ryan building, I should mention, we also have our maternal fetal medicine office, which focuses on the management of high-risk pregnancies and pregnancy-related testing and ultrasounds.
So how is this? This is obviously helping patients, having all these different specialists in under one roof.
Absolutely. Having these women's healthcare specialties in one location really allows for a more streamlined coordination of care, which always translates to easier patient access and a more pleasant patient experience.
And for you as a doctor, too, it must help to have this team that you can rely on.
Absolutely. We coordinate care amongst each other, as well as with our community OBGYNs, who we work closely with.
This time of COVID, we've been talking about any concerns that I know earlier in the year, like in the spring, many women were ignoring their own health. Do you have concerns that there are still a lot of women out there not paying attention to their health, not getting their basic routine checkups and tests?
Unfortunately, what you're speaking about is absolutely true. And, despite these challenging times with COVID, it remains absolutely necessary that women maintain routine checkups, as these preventative health visits, they really have the potential to uncover critical underlying health issues. And so, for instance, if a woman is experiencing pain, abnormal bleeding, or especially postmenopausal bleeding of any type, these are just a few very common problems to seek medical attention promptly, because early medical intervention, especially in these situations, can potentially prevent a minor diagnosis from developing into a much more severe condition.
And what is really the basic that women should be doing every year?
So, at a minimum, every year, women should be seeking care with either their primary care physician, whether that be a family medicine physician or their OBGYN. Guidelines have changed more recently in terms of things that women typically associate with, such as pap smears, but your OBGYN can guide you through that process. But at a minimum, an appointment and a visit to the office is an absolute must.
And people who are a little worried, the offices are really taking a lot of precautions.
Absolutely. All precautions have been taken care of in coordination with CDC guidelines. Social distancing is an absolute must. Mask wearing is an absolute must. And in terms of the cleanliness of the offices, they are really spick and span. I'm really very impressed with the way the facilities have been maintaining everything.
I have to admit, right, going to the doctors, I was really reassured on all the precautions. I went to one doctor where you actually waited in the parking lot until it was
Absolutely.
your turn. Yeah.
Yes.
So, Dr. Sticco, thank you so much for the update and what's going on at CHS.
Thank you for having me.